So with that, I think we should start the opening statements, and we'll start with Dr. Peter McCullough. By the way, I asked everybody to submit their bios in 75 words. Their qualifications are so extensive, it was very difficult for many of them. I apologize, I've cut them down to 75 words, but you can kind of fill in some of the gaps. But Dr. Peter McCullough is an internist, cardiologist, epidemiologist, and a leader in the medical response of the COVID-19 disaster. He published Pathophysiological Basis and Rationale for Early Outpatient Treatment of SARS-CoV-2 Infection, the first multi-drug protocol for ambulatory patients infected with SARS-CoV-2 in the American Journal of Medicine, which he subsequently updated in reviews in cardiovascular medicine. He has more than 650 PubMed listings, 52 on COVID-19, and has commented extensively on the medical response. And again, this just barely scratches the surface of Dr. McCullough's qualifications. So, Dr. McCullough.
Ladies and gentlemen, it's a pleasure to present now for a second time in the U.S. Senate. And I have organized my comments along the 4 pillars of pandemic response. I presented this to America November 19th, 2020 in the Department of Homeland Security and Governmental Affairs Subcommittee on Early Treatment. That was one of 2 historic Senate subcommittee hearings led by Senator Ron Johnson. And in that hearing, I presented the concept that our country should have always had a balanced approach to responding to the pandemic along 4 major principles. The first is to limit the spread of the virus. We quickly learned that this virus was a respiratory virus, that it spread from someone who is sick with symptoms to someone who's susceptible, who could actually acquire the infection, and they themselves become symptomatic. We learned early on that the virus is not spread from an asymptomatic person to another asymptomatic person. It was always symptomatic to susceptible person. And for those reasons, we had an opportunity on contagion control, but our efforts to do so were extremely limited. You can see the type of effort to limit the spread of control regarding hand sanitizer. It's not a hand infection. We quickly learned that it's not a hand infection. It's not spread by hands or pizza boxes or other objects. It was actually spread by an aerosol in the air. And later on in this proceedings, we've asked Dr. Bhattacharya from Stanford to present a brief video on the Great Barrington Declaration, because he led that effort with others that addressed some fundamentals on pillar number 1. Pillar number 2 is the pillar of early treatment. And I think everyone in this room could understand there are only 2 bad outcomes with COVID-19: hospitalization and death. And if everybody in this room and everyone in the nation understood that they could get a respiratory illness and survive it in the comfort of their own home, assisted by medications in some individuals who were at high risk for that outcome, they could get along with that and understand that America would get through this illness together. And as we sit here today, there are 217,000 papers in the peer-reviewed published literature in PubMed. 94,000 of them deal with hospitalization and death as an outcome and in hospital treatment. 26,279 deal with vaccines, and 1,417 deal with treatment, and a small fraction of that is early treatment. We're going to hear from experts today on the principles of early treatment based on drugs used in combination with a signal of benefit and acceptable safety to be used under the guidance of the precautionary principle that this is a mass casualty event and we cannot wait for large randomized trials that are not forthcoming. And we certainly can't wait for guidelines that depend on those randomized trials. The third pillar is hospital care. We are going to hear today from experts who have a tremendous experience, some in the outpatient and the inpatient realm in the continuum of care, and others exclusively on inpatient care. But I can tell you, as a doctor, making an observation, being in a large academic medical center, currently in Dallas, Texas, but also throughout my career, to this day, we're 2 years into the pandemic, there is not a single hospital in America that is holding itself out as a center of excellence for the treatment of COVID-19. Yet those same very medical centers hold themselves out as experts in cardiovascular care or cancer care. There's still not a single academic medical center there in the United States today that has an early treatment program or even has continuity of care of patients going from the outpatient to the inpatient and back to the outpatient realm. The fourth pillar is vaccination. And vaccination, as we see it today, has been the central effort of our federal relief in COVID-19. And we're going to have a very careful review of vaccination. In fact, mass discrimination, another term that applies to that is indiscriminate vaccination. Now, I can tell you, speaking for the doctors around this table, we widely use vaccines as part of our clinical practice. This is a part of medicine. It is a standard accepted part of medicine. We have over 70 vaccines that are used in clinical practice, and they do work to help prevent the binary outcome of getting a disease, particularly a disease that is a low prevalence disease or a disease that one yet has not acquired. But never in human history have we widely applied vaccinations into the middle of a widely prevalent pandemic where people are falling ill, recovering, and falling ill again. And we will hear about vaccines and their role in pandemic response. So I've set the table. These are the four pillars of pandemic response, and I'll turn it back over to Senator Johnson.
Thank you, Dr. McCullough.